Okay, today we'll be doing here the pregnancy test. So, this is one of the example of our immunoassay with the use of our rapid test kit. So, the rapid test kit, just like our pregnancy test kit, make use of our test cassette. Okay, so basically, our test cassette would have here the test line. Medyo hindi siya kita. There's a test area and we have also here the control area. Okay, since we are detecting for the pregnancy test, which is the human chorionic gonadotropin hormone serving as our antigen, our test membrane here is eventually impregnated with the monoclonal anti-human chorionic gonadotropin as our antibody. Since again we are detecting in our urine sample would be the antigen, which is the human chorionic gonadotropin. Okay, so our test membrane is also impregnated, especially here in the control area with the monoclonal IgG antibody. And at the same time, it's also impregnated here with another antibody containing a colloid conjugate, which is responsible here for the carrying the or giving the color reaction. Where in the end, the reaction for this one would be the formation of your purple band or line, signifying here a positive test result. Okay, so the procedure for this one, so it's already been added here, or you can find here the procedure already in the individual test kits. Okay, so for our procedure, so be needing only here, okay, so 2 to 3 drops of the urine sample of our patients. Again, the pregnancy test is for determination of the human chorionic gonadotropin, which is the hormone we try to increase during the pregnancy. However, not only patients who are pregnant who are going to give a positive test result for this human chorionic gonadotropin present in the urine sample here of the hormone, but there were also condition here, like for example in the cancer, like your H-mole, high DATD4 mole will also give a test positive result here with the pregnancy test or for determination of the human chorionic gonadotropin. So we need to discriminate if the patient's really pregnant or is the patient is having that H-mole, if the patient is going to get a positive test result for this one. So you can have your ultrasound for you to check if the patient's really pregnant. It's because the positive siya dito sa ating pregnancy test, or if the patient is also positive, not because of the pregnancy, but H-mole, of course, that will be manifested or can be detected in the ultrasound na wala siyang baby. Okay, so again, we have here, procedure says here to be needing only to drop here 2 to 3 drops of our urine sample. Okay, ideally for the pregnancy test kit, our sample for this one can be a serum sample or can also be a urine sample. So just need to check for your test kit if that test kit you can use the urine sample lang ba, or the test kit can also allow you to perform if your sample is a serum sample or the blood sample. But in our case, for this test kit, I think it's only for the urine as our sample for you to identify here or determine here the test result if it's positive or not. And at the same time, this one is only a qualitative test. So we just have here the positive or the negative. So it would not determine here the concentration of the human chorionic gonadotropin. Okay, and ideally the sample for the testing here for our pregnancy tests would be the first morning urine. Although you can have also the random urine, but you need to be careful with that. It might be result to your false negative result. Okay, so again, for the procedure, just have your, okay, we have here the sample well, where you're going to add your sample here. So just have here 2 to 3 drops. And we have also here the pouch also being added with the dropper already. Okay, so we have that one, 2 to 3 drops. Okay, then you're going to start the timer for this one. Okay, so wait here for up to 5 minutes. Okay, so just wait for the specified time here for you to read your sample. Okay, so after the specified time here of the waiting time for the reading, so we have here the test result already. Again, you always try to check here for the specified reading time for whenever time you are doing your tests. So never ever read the result here beyond the recommended reading time because it will have here some false interpretation. Okay, so again, so we have here the control line and we have also here the test line. So again, the control line here serve as our internal control. So that would always help us as part of the quality control program. So in order for us then to check for the validity of our testing process. So in order for you to accept here the test result, then your control line should have here a purple band or a line. So like for example, if your test procedure here would have, or test kit do not have here the line on the control line, then that would warrant here the test to be invalid. That's why this one is being incorporated with the control in order for us then to check for the validity of our testing process. So for the interpretation, so we have here the T for the test. Okay, so wala siya ditong line. So our interpretation for this one will be considered here as a negative test result. Okay, so thank you.